Hello everyone. So today we'll discuss about the pathology of the chronic obstructive pulmonary disease, that is a COPD. So first of all, what is COPD? COPD, that means it is a group of disease which is characterized by the obstruction of the airway, as the name says, chronic obstructive pulmonary disease. That means there is airway obstruction occurring which is causing the disease, and the group of disease is known as the COPD. Number the sentence group of disease. Which disease are we including in the COPD? That is 4 disease: chronic bronchitis, asthma, emphysema, and the bronchiectasis. Now what's actually happening in the COPD? So as the name says, obstruction, what will happen? There is some kind of obstruction happening in the body, right? So let me give you an example. So this is a room, right? And if you want to go out of this room, okay, there is a door. Okay, so you can easily go out of this room. But what if the door is closed? What will happen? You won't be able to go out. There is an obstruction over here which is stopping you from going out of this room. So same way, same thing is happening in the body as well, in the lungs as well. Because of the obstruction occurring in the body, whatever the air is present in the lungs is not able to go out. And as because of this, the lungs force vital capacity is decreased. What is force vital capacity? That means the amount of air you are exhaling. Okay, but as the door is closed, air in your lungs won't be able to go out. So this will cause decrement in the forced vital capacity of the lungs. Now also there is decrement in the forced expiratory volume of the lungs. And because of this, the ratio of FEV1 by FVC will be decreased. And also because of this, what is happening? There is increment in the total lung capacity. What is TLC? That means the amount of air present in your lungs after forceful inspiration. Okay, so whatever air you are inspiring, but you're not able to expire, you're not able to exhale the air. And because of this, the lung capacity, your total lung capacity is increased. And this is the common phenomena seen in the COPD. That means the amount of air you have inspired, you are not able to expire, you are not able to exhale the air. And because of this, there is retainment of the air in your lungs. So again, there are 4 types of COPD, that means the chronic bronchitis, asthma, emphysema, and the bronchiectasis. So in this video particularly, we will discuss about the chronic bronchitis and the emphysema. So first of all, the chronic bronchitis. So the person suffering from the chronic bronchitis, they are also known as the blue blotters. Why? Because the people suffering from the chronic bronchitis, their lips and their skin becomes blue. The lips and the skin turns blue in color. The person suffering from the chronic bronchitis often take deeper breaths, but they can't take it in the right amount of oxygen in the body. And because of the decreased amount of oxygen in the body, it causes their lips and the skin to turn blue. And therefore, they are known as the blue blotters. Now, what happens in the chronic bronchitis? There is chronic cough production which lasts for at least 3 months to 2 years minimum. And the main reason of the chronic bronchitis, it is the smoking. Smoking is the main reason behind the chronic bronchitis. And the chronic bronchitis, it is characterized by the hypertrophy of the bronchial mucinous glands. So this is the healthy and this is the inflamed bronchus. And in the inflamed bronchus, there is hypertrophy of the mucinous glands. So let's see in this diagram. This is the healthy bronchus and this is the chronic bronchitis bronchus, or abnormally thickened mucus glands observed in the chronic bronchitis bronchus. And because of the hypertrophy, increase in the size and the growth of the mucus gland over here, there is increment in the thickness of the mucus glands with respect to the bronchial wall thickness. That means this mucus glands are very thick as compared to the bronchial wall, which is causing inflammation over here, which is leading to the increment in the Reed index. Reed index in the normal person, it is 0.4. Now first of all, what is Reed index? That means thickness of the mucus glands upon thickness of the entire bronchial wall. Okay, so the ratio of these two, that means the thickness of the mucus glands and the thickness of the entire bronchial wall, the ratio of these two is known as the Reed index, and it is normally 0.4. But as over here in the chronic bronchitis, there is hypertrophy of the mucus glands. What is happening? There is increment in the thickness of the mucus glands, and because of this, there is increased value of Reed index in the chronic bronchitis, which is increased by more than 50%. So again, what is observed in the chronic bronchitis bronchus? Inflammation, narrowing of the lumen over here because of the uh, excess mucus production, which is caused because of the hypertrophy of the mucus glands, because the mucus glands are increased in their size, there is hypertrophy of them, it is causing excess mucus production, which is causing excess amount of cough production, which is leading to chronic cough production in the chronic bronchitis. I told you before also that in the chronic bronchitis, there is chronic cough production lasting for at least 3 months to 2 years minimum. And this characteristic is caused because of this reason. There is hypertrophy of the mucus gland, which is causing the excess mucus production, which is leading to chronic cough production by the chronic bronchitis patient. So inflammation, then the narrowing of the lumen, and this narrowing of the lumen is caused by the excess mucus production, excess hypertrophy of the mucus glands. Also narrowing of this lumen is caused because of the thickening of the smooth muscles around the in the bronchus, and because of such things the lumen is shortened, or we can say the lumen is narrowed, which is causing obstruction. So are you getting? In the chronic bronchitis, there is obstruction in the airway because of the excess mucus production, hypertrophy of the mucus gland, thickening of the smooth muscles in the bronchus, and also inflammation. These all are the reason of the obstruction in the lumen, which is causing COPD, chronic bronchitis. Now another clinical feature seen in the chronic bronchitis, it is the chronic cough production. Cyanosis. Why? Because they are known as the blue blotters. Why? Because the lips and the skin turns blue. Because even after taking deeper breaths, they are not able to meet the right amount of oxygen content in the body, due to which decrement in the oxygen demand in the body, which is causing the lips and the skin to turn blue, leading to cyanosis, and they are known as the blue blotters. Another one is the cor pulmonale, because of the lungs dysfunction. So this was about the chronic bronchitis. I hope you understood this well. Now next is the emphysema. Now the patients suffering from the emphysema are known as pink puffers. Why? Because they have difficulty in catching their breath, and because of this their faces turns red while gasping the air, and that's why they are known as the pink puffers. Well, if you remember, the chronic bronchitis patient, they are known as the blue blotters, while emphysema, pink puffers. Now what happens in the emphysema? Now over here, because of the loss of the elastic recoiling, there is alveolar air sac destruction, which is leading to dyspnea. Okay, and because of this alveolar air sac destruction, there is airway collapse occurring at the time of exhalation. At the time of exhalation, there is airway collapsing, which is leading to the obstruction and the air trapping inside the lungs. So this is the common cause of emphysema. There is a loss of elastic recoiling, which is leading to the alveolar air sac destruction, leading to the airway collapse during the exhalation, leading to obstruction and the air trapping in the lungs. Now just tell me, what is the main reason behind this emphysema by these three lines? What you have seen? The main reason you can clearly see is that there is loss of elastic recoiling by the alveoli. Okay, and because of this only there is alveolar air sac destruction. So now what can be the reason behind the loss of this elastic recoiling? So the main reason behind the elastic recoiling, it is the imbalance between the protease and the antiprotease. Now we have three reasons behind this loss of elastic recoiling. The main reason out of them is imbalance between the protease and the antiprotease. So over here, first of all, just remember, over here in the protease we have the trypsin. Main protein over here, it is the trypsin, and the antiprotease, it is the alpha-1 antitrypsin. Now what happens? Whenever foreign particles enter inside our body, our neutrophil and the macrophages releases the protease enzyme, and this protease enzyme causes the destruction of those foreign particles, and because of this destruction it causes the inflammation in the lungs. Now in normal amount, this protease is okay because it is causing the inhibition of the foreign particles, but whenever the protease amount is increased in the body, God has given us antiprotease as well, that is alpha-1 antitrypsin. It will inhibit this protease, and because this protease in normal amount is okay, but if the protease increases, it will cause excess inflammation in the lungs, which is dangerous. So to inhibit this inflammation, this antiprotease alpha-1 antitrypsin, it will destroy or inhibit the protease, and minimizes its effect. But in this emphysema, what will happen? There is increase in the protease in the lungs. Okay, and because of this protease increment, there is inflammation. Plus, there is this protease will cause inhibition and the breakdown of the elastin protein, the elastic protein in the alveolar, in the alveoli of the lungs, and this will cause loss of elasticity, loss of elastic recoiling of the alveoli, which leads to destruction of them, which leads to destruction of the air sac, and this will lead to collapsing of the alveoli leading to emphysema. So in simple words, there is increment in the protease and decrement in the antiprotease, which is leading to the increment in the destruction, or we can say the breakdown of the elastic protein in the alveoli, which is leading to collapsing of the airway, the collapsing of the air sac, which is leading to emphysema. Now another reason, it is the smoking. Over here, because of the smoking, the upper lobes are affected, and the common emphysema seen in the smokers, it is the centri-acinar emphysema. We'll discuss about the types of emphysema in this video only, but over here just remember, due to smoking, centri-acinar emphysema is caused. And over here the reason is again the same. There is increment in the inflammation of the lungs in the smokers, and also increment in the protease enzyme, leading to loss of elasticity of the alveoli, leading to the airway obstruction and destruction. Now next reason, it is the A180, that means the alpha-1 antitrypsin deficiency. Now because of this, what will happen? Of course, I told you before also, it causes the inhibition of the protease enzyme. But in some people there is deficiency of this enzyme, which is causing increment in the protease, which causes the destruction of the alveolar elastic recoiling. And in the A180 deficiency, the lower lobes are mostly affected, leading to pan-acinar emphysema. Now this alpha-1 antitrypsin deficiency also lead to liver cirrhosis. Why? Because over here, in some people, there is misfolding of this alpha-1 antitrypsin enzyme, which is causing accumulation of the misfolded alpha-1 antitrypsin in the endoplasmic reticulum of the liver, which is leading to liver damage. Now these are the genes, or the mutation of the genes coding for the alpha-1 antitrypsin. Okay, so this gene is normal. This is showing the low level of the severity of the disease. Over here, this is severe, but they are asymptomatic, and this is the most severe one. Okay, showing the pan-acinar and the cirrhosis together. Now very important, types of emphysema. So we have, first of all, the centri-acinar emphysema, pan-acinar emphysema, paraseptal emphysema, and the irregular emphysema. So first of all, the centri-acinar emphysema. So I told you before also, it is commonly caused because of the smoking. This centri-acinar emphysema is also known as the centrilobular emphysema or the proximal acinar emphysema. Now the centri-acinar emphysema mostly includes the upper lobes of the lungs. The upper lobes of the lungs are mostly affected in the centri-acinar emphysema. Now this may cause chronic bronchitis, okay, and seen in the smokers and the coal mine workers. The centri-acinar emphysema, most importantly, it is caused in the upper lobes, and there is dilation of the respiratory bronchioles. The next is the pan-acinar emphysema. Now over here, the whole sinus is affected. And this pan-acinar emphysema, if you remember, I told you that this pan-acinar emphysema is seen in the lower lobes of the lungs and seen in the person having the deficiency of the alpha-1 antitrypsin in the body. And even the smokers can even have pan-acinar emphysema. So smoking is very hazardous. Now next is the paraseptal emphysema. So over here, this is also known as the distal acinar emphysema. Why? Because there is the peripheral part of a sinus, plural, and the peripheral part of the sinus included, or we can say affected over here. And this may lead to spontaneous pneumothorax predeposition. Also, it is adjacent to the foci of the fibrosis. Now next is the irregular emphysema, also known as a mixed or unclassified emphysema. So over here, at different location, you will see the scar tissue present over here at different location. Okay, irregular one. So four types: centri-acinar, paraseptal, pan-acinar, and the irregular. Now, another clinical feature seen in the emphysema patient, they are the dyspnea, means difficulty in the breathing, cough in the sputum, then known as the pink puffers. There is weight loss seen, barrel chest. Barrel chest is the most important clinical feature of this emphysema. Hypoxemia, why? Because there is air sac capillary destruction in the emphysema and the cor pulmonale, which is the late complication observed in the emphysema. So today up till here, we discussed about the COPD, emphysema and the chronic bronchitis. We'll discuss about the asthma and the bronchiectasis in our next video. So I hope you found this video helpful. Thank you so much.